Teen mental health first aid is intentional in its implementation and administration requirements. Because we're working directly with minors, the requirements around the program are more strict than our other course offerings. The course is split into 6 45-minute instructor-led sessions or 3 90-minute instructor-led sessions. These sessions should take place with 1 to 14 days in between each session. The course is intentionally split up to allow teens time to digest the information and to also not overwhelm them with too much information. The teens will take a pre-evaluation to establish their baseline knowledge about mental health, stigma, and how they would help a friend. They'll go through the Teen Mental Health First Aid course, and then they'll take that same survey following the training to quantify the positive impact of the course on teen participants following completion of the training. Additionally, all teens must receive a physical copy of the Teen Participant Manual that is purchased through Mental Health First Aid. The course requirements change depending on if you are inside or outside of a school setting. Inside of a school, the course is meant to be taught to grades 9 through 12 and should be administered with an entire grade level or a class such as health or PE that is a requirement to graduate. Currently, you cannot implement with extracurriculars, after-school activities, clubs, peer mentors, or athletics or anything similar at this time within a school setting. If you are outside of a school setting, you need to be offering the course to the 14 to 18-year-old population that you serve. Not everybody needs to be trained within that population, but everyone needs to have the ability to sign up for the course if they wish to do so. Class sizes should be 5 to 30, and you'll want to have 5% of staff trained in youth mental health first aid wherever the course is being taught. Youth mental health first aid is for adults who work with youth ages 12 to 18. Additionally, you'll want to make sure that you have a safety protocol in place in case a teen indicates they're in distress during the training, and you will also want to be using exit tickets at the end of each session so teens have a discreet way to ask for help if necessary. A key component of the Teen Mental Health First Aid course is getting a trusted adult involved. This is why we have the Youth Mental Health First Aid requirement. Again, Youth Mental Health First Aid is for adults who work with youth ages 12 to 18, and the training can be provided before the teen course begins or concurrently with the teen course. This approach creates opportunities for increased trust and shared understanding between teens and their parents. You can take Youth Mental Health First Aid in person. It's an 8-hour course, or a blended version where it's 2 hours self-paced online, followed by a 5-hour instructor-led training either in person or online. You can use the Find a Course tool to find public trainings, both online and in person in your area that you can sign your staff up for. It's valued at $170 per person. However, the cost for this varies as the instructors set their own fees. If you are looking to train teens at multiple sites, I would recommend training a staff member to become a youth mental health first aid instructor. That way you have more flexibility to take the trainings to different sites and to stay within the implementation requirements. Sites must have 2 adults in the training room at all times. The first adult would be the teen instructor. The second adult doesn't have to be an instructor. However, I would recommend they are youth mental health first aid certified at the least. Sites should also ask local mental health professionals from outside the school or organization to be available while the program is being taught. This can be a social worker, psychologist, psychiatrist, anybody you would feel comfortable with saying, hey, in the event of an emergency, would you be able to support us?